So today we're going to be doing some Kybella. Kybella is deoxycholic acid. It's a fat blaster, and it's FDA approved for the submental fat, which is this area here, right under the chin. You can see these white markings that I've marked out are the safe area inside which you can inject the Kybella. So the mid-pupillary line, right, coming down onto the neck, right below the mentum, so below the chin, and then above the cricothyroid cartilage. Okay, so you want to be above that. So in here is going to be the safe area where you can inject it. You don't want to go laterally because there's arteries, nerves, things that you don't want. You obviously don't want to go lower either. So this is going to be the safe area. Those are a temporary tattoo. You see all those colored markings. And what we're going to do is, you're going to see I'm going to pinch, okay, the skin up. And I'm just going to inject a small amount. And I'm pinching it to stay safe, so I'm staying away from any vital structure. So I'm literally lifting the submental fat up. Okay. So that was the first row of treatment. Okay. Now then you can see their coloration so that I can see where I've gone and where I have to go in the next round. Okay. So now here, people often ask, do you go through the colorations? The answer is no. You don't want to actually tattoo the patient. So I'm intentionally going right underneath or right next to the coloration. There is a little stinging. The patients remark that it's a little stinging. They usually get used to it after the first couple injections. Turn your head a little bit towards me. So again. Now immediately what the patients notice is some burning right away. That goes away after a couple minutes. Within the first 2 or 3 days, they may have some swelling. Usually it's swelling that only they notice. So it's not swelling that anyone else notices, but it is noticeable to the patient. So it's important to counsel them, tell them, so that they're ready for it. Okay. So again, you can see how I pinch up the skin before I inject. And the reason I'm pinching up the skin is to take the submental fat away from any vital structure. So obviously we don't want to inject it into anything deep because that could be potentially dangerous. So I'm intentionally staying superficial in the submental fat pad. And these different colorations are actually very helpful to the injector. As you can see, now I'm going to go for the orange, and now I know where I'm going to go. Typically, you space your treatments out, minimum of 6 weeks apart. This is FDA cleared for up to 6 treatments, although in my experience, usually 2 to 3 treatments, patients are happy. I do measure them. Obviously, we take all the measurements, we take photos, just to see, to confirm. But I would say most of our patients are happy after 2 or 3 treatments. Again, 6 weeks apart. You bring them back, you remeasure them, and take photographs. Almost done. I just got two more tiny little shots left, and then we're done. Okay, so the last 2, just gonna go one right here, And then one symmetric on the other side. Okay, we're all done. How was that?
Yeah, it wasn't bad.
A little stinging, right?
Mm-hmm.
But now it's over? Yeah?
Yeah.
Yeah.